Today we're talking pregnancy and running. We're going to cover all the things that you should do to continue running safely through pregnancy and post-pregnancy. I'm going to hand you over to Dev to kick things off.
Let's start by looking at the benefits of running while pregnant. Now this is twofold. If you are looking at starting running when you're pregnant, you really just want to be cautious and build your volume nice and slow in a slow progression. The second side of it is if you have been running prior to falling pregnant and are now pregnant, you still can run, it is safe to run, and there are benefits to this. Naturally, there will be a couple of considerations and cautions around it, and it is always advised to work with your doctor and get recommendations as to the kind of running and exercise and volume that you should be doing. But all in all, there are benefits, and we're going to get into that now. Firstly, we know that running is really good for anxiety or to relieve anxiety and stress. The running while you're pregnant really does just give you a little bit of time to yourself as well. You can get out there, be in your own mind, enjoy your run, enjoy the space, and just helps to reduce anxiety and stress. There's a reduced risk of gestational diabetes. Things like reducing the risk of preterm birth is key here. There are reduced risks of preeclampsia or pregnancy-induced high blood pressure. There's reduced risk of having a high weight baby when your baby is born. There are also signs of reduced risk of emergency cesareans. It's also been shown that there is a chance of faster labor with training throughout pregnancy. So all in all, there are quite a few benefits here that we can get from keeping you training throughout your pregnancy.
So Dev has gone through the many benefits of running while you're pregnant. What are some of the risks and things you need to take into consideration? Of course, there are inherent risks with running, and of course there's inherent risks while being pregnant. If you have complications while you're pregnant, things such as bleeding or spotting or things that they've picked up such as placental problems, then you definitely need to speak to your physician or your doctor and make sure that it is safe for you to run while you're pregnant. The general kind of consensus is that if you have been running before you fell pregnant, it's generally going to be safe for you to continue to do so. One of the things that puts you at a higher risk is if you fall pregnant and now you want to start running. Your body isn't even used to you running normally, now you want to do that while pregnant. That is a bit of a concern. One of the other things you need to consider is that if you're carrying multiple babies, running can be a risk because it can put you at risk for a premature labor. So really ensure that you speak to your doctor or your physician about that to clear that you are able to run while pregnant. So generally, for those with uncomplicated pregnancy, there's no harm in continuing with your running program or training regime. It's not going to cause you to miscarriage, and you can continue with that. And Dev has shown you all the benefits that do come from running while you are pregnant. Fueling is really important while running generally. It becomes even more important while you're pregnant. We have to ensure that we're providing our bodies with the correct fuel for what we're asking it to do. Now, you have a small human growing inside of you. Fueling becomes even more pivotal. One of the things that you need to consider is that before you go out for your run, you have to give your body the energy it requires. And a lot of people don't generally eat before a run. They don't like to, but this becomes really key here. However, when you're pregnant, you want to ensure that you're giving yourself a little bit more time before your run to take some nutritional fueling in, because digestion does take a little bit longer while we're pregnant, and so you want to just allow yourself a little bit more time before your training or before your run to ensure that you're getting the correct fuel. After your run, again, pivotal, we want to replenish what we use during that run, and you really want to focus on your protein intake as well as your carb intake, but while we're pregnant, a little bit more protein than we normally do when we're not pregnant.
So now that we know the benefits and the risks to running while pregnant, let's practically look at how much we should be doing. Science has proven that doing at least 150 minutes of training per week shows a lot of those benefits that we've already mentioned. Now I need to just split this here. If you haven't run before pregnancy or during pregnancy, it is important that you are starting slowly. Like any training or any training program, you're not diving straight into doing massive volumes of training. So I do want to caution you around starting slow, think about a slow progression and building up appropriately. If you have come from a running background and you have been running pre-pregnancy, then that 150 minutes is at least 150 minutes of training per week. I want to also just point out, it needs to be an accumulated duration. So that's not to say once a week go out and run 150 minutes or more. You need to be doing at least 3 days a week of training for those benefits to really show. So at least 3 days, whether you're breaking that down into 30-minute sessions each one, potentially doing a couple more days in the week. Don't ever neglect the fact that we still want rest and we still want recovery around training, but you can start to build that up 150 minutes or more, taking all proper training principles into account, at least 3 days a week for you to continuously be seeing the benefits, as we've already mentioned, during your pregnancy. Another thing to consider in terms of the volume, or rather the intensity of training during your pregnancy, is to keep in mind that your body is undergoing changes throughout this entire time. We want to focus on a perceived exertion rather than necessarily trying to target a particular pace that you might have been used to before falling pregnant. Work on feel. Easy runs, for example, still need to feel easy. If that means you're slightly slower, there really is no problem with that. You really need to just be making sure you are working to a perceived effort throughout your training. Keep in mind that, as I mentioned, just with the bodily changes you will be undergoing, your fitness level might be at a level that's higher than what your body currently can allow. And this is why we talk about using that perceived effort, so that you're just listening to what your body's telling you rather than trying to chase goals that we know you're capable of, but the body at the moment is just saying, hang on, I need a little bit more of a break and I need to just pull things back slightly.
As you progress through your pregnancy, there are going to be a couple of things that are going to happen. One of the side effects of growing something inside of you is that you are going to be picking up a little bit of weight, and you are also going to be releasing hormones as the pregnancy progresses to prepare you for the act of childbirth. Strength training is really important to help prepare your body both for the pregnancy and to maintain strength and prevent you from getting injured as you continue to run through pregnancy with that slight weight gain, and with your ligaments and tendons becoming more and more lax and the control of your muscles becoming more and more important to allow you to run pain-free during and post-pregnancy.
So you've been running through your pregnancy, and very often people ask us, well, when do we stop running? When is it safe, or how long can we continue to run for through pregnancy? For the most part, people, in my experience, don't like to run in the first trimester because they generally just feeling quite yuck. There's morning sickness and so on, and if you are lucky and you don't have any of those sort of complications, good for you and enjoy your running. The second trimester is very often regarded as this honeymoon sort of trimester. That is a great time to maximize your running while you're pregnant. As you're moving in towards your third trimester, there's an increase in a hormone called prolactin. What that does is it's making your ligaments lax, preparing you for the birth of your child. And so at this point in time, running does have an inherent risk because your ligaments are more lax, which puts you at a higher risk of injury. So it's at this point in time where maybe converting away from running and into a little bit more strength training would be really beneficial for you, as opposed to going out there and hitting the road really hard. One of the other reasons to stop is an obvious one, is when there are other complications that arise. So that can be things like urinary incontinence, pelvic pain, or pelvic floor concerns. And so those complications are an excellent reason to stop running in your third trimester. So you've had your baby, your bundle of joy is here. What are some of the guidelines for running postpartum? Firstly, you must realize that your body has gone through an extreme life event, and so it does require some rest and recovery. So don't rush back into this. It's really something that you must do in your own time. Rushing back is not going to be better. Rather give your body the time it needs to recover from what it's gone through. Secondly, with that, you always want to be guided by your doctor, your physician, especially if you've had a C-section. You would need time for that wound to heal before you jump straight back into running. So please be guided by your physician as to when is safe for you to return to running. You're probably at this point in time not getting much sleep either, and so don't sacrifice going out and running and stressing about running just because you want to, when you actually really require some decent sleep. Running postpartum does come with some complications. Even though you've had your baby and you know, your body's returning back to normal, there is still that hormone prolactin floating around, and it does still allow for your ligaments to be quite lax, and so there is still that inherent risk of running that you might get injured. So just be aware of that. There are other complications such as diastasis recti, that is the separation of the abdominal muscles, and so just be aware of that and chat to your doctor if that is something that is coming up. Other concerns such as pelvic plane and urinary incontinence, please seek out the help from a pelvic floor specialist or pelvic floor physio for those complications to help you get back to running. Something that I've found with the athletes that I've worked with is while they're pregnant, they're seeing a pelvic floor physio or specialist to help them with some exercises so that they can really sort out those issues, that urinary incontinence doesn't become a common concern. If urinary incontinence is something that you are struggling with postpartum and running, just know that that is common, but it shouldn't be something that is considered normal and should just be like that for the rest of your life. There are professionals out there that can help you with that, and so please go see a pelvic floor specialist if that is something that you're struggling with.
It's really important to take note of the increased energy demands when you are breastfeeding. This is so important when you want to continue exercising post-pregnancy. The amount of weight loss that I witnessed with my wife after she'd given birth to our 2 children through breastfeeding really opened my eyes up to the physical demand of feeding another human being. And so it is so important that you work so hard on hydration and nutrition and make sure that you are not putting yourself at risk by not getting in enough nutrition while training and breastfeeding. When starting out again, it's really important to know that your body is still full of prolactin for up to 6 weeks post-pregnancy. Now that means that your ligaments and tendons don't have their normal integrity. So you do want to start out really slowly. And I would encourage you, when you start up again, to start out with a lot of walking and a little bit of running and slowly transition that over. And much like during pregnancy, strength is so important to help protect your body as you start up again. So we want to start with lower intensity, lightweight exercises. Things like body weight exercises are excellent, and you build that up slowly while you are transitioning from walking to running so that you can exercise and in particular run safely post-pregnancy. Moms often report post-childbirth that they have a much higher pain tolerance. And this is something you need to be a little bit careful of, because what it can do is it can actually lead you to doing too much too soon, building up too quickly, pushing yourself too hard. So when you start out, it's extra important that you take note of how important it is to really just build yourself up slowly after pregnancy and take your time getting back to your normal level of running. The biggest risk during this time is just doing too much too soon. Watch this video to see how to structure your training.